Berkowitz from Men in Film News. This afternoon we're visiting the 12th Street office of Dr. Joyce Wallace, an AIDS researcher who was among the first New York City physicians to recognize cases of AIDS in gay men. Dr. Wallace is a fellow of the American College of Physicians, an assistant attending physician at St. Vincent's Hospital in New York City, an assistant clinical professor of medicine at Mount Sinai Medical School, and she's also a scientific advisor to the AIDS Medical Foundation based in New York City. What is unique about Dr. Wallace's research is that she is studying the immune systems of women who are sexually active. Last year, Dr. Wallace was awarded a $1,000 grant from the Gay Men's Health Crisis in order to study the immune function of women who are sexually active. Her findings were reported last year in The Lancet.
I have a relatively small practice in Greenwich Village. It's not exclusively gay men. Only 1/3 of my patients are gay men, and yet I've had 30 patients with AIDS, at least half of whom were patients belonging to this practice before 1979, before I took it over. So that it's a very high number. The incidence is very high. I think it's approaching 2%. And I was thinking that once in a while I meet some friends, older straight people, who'll say to me, well, it isn't much of a problem, is it? And they just don't know. They don't see and they don't understand that it is very much of a problem. Because we were seeing patients very early here on 12th Street, myself and Dr. Sonnabend, down the block on 12th Street, started saving blood specimens from patients as early as the spring of 1981. And we sent off, actually Joe Sonnabend did it. He said, well, you know, we were interested in their T cells because we had we knew that there was a defect in cellular immunity. So he called the two people who were responsible for making monoclonal antibodies up against T cells and making a whole new line differentiating the T cells, which is a system called the OKT cells, the OKT series, and that was Stuart Schlossman and Ellis Reinhertz at Harvard. He called them up and said, are you interested in looking at the blood on these patients? And they said, sure. So we started sending up samples flying them out to getting them out to the airport and flying them up to Harvard. We did that once a week for a few months, and in doing so, we had a lot of data as to patients with AIDS, patients with lymphadenopathy, and what we thought were the control group of healthy homosexual men. And lo and behold, when we looked at our control group, that turned out to be one of the most interesting findings, because the AIDS patients, as other people were finding, had very low T-cell ratios, very, very low, inverted ratios. The lymphadenopathy people had low ratios also, but not as low. But the healthy homosexual men also had low ratios. And because we knew our patients so well at this select group, we looked at them and we realized that the ones who were normal were the men who were monogamous. The healthy these are the patients with AIDS, and they had very low T-cell ratios. These are the patients with lymphadenopathy. And the patients who were healthy were divided into two groups according to their sexual activity. So that the monogamous men with 3 or less contacts a year are up here, and they're all normal. Whereas the men who had 50 or more partners a year, one of them was normal, but most had lowered ratios. So these were healthy controls. They had no problems at all. It'd be interesting to follow up on them now, actually. This is I think this was the first time we said that sex was ever plotted on a straight line.
Gay men are looking for answers as to whether or not they're at risk for AIDS or whether or not they're immune suppressed, and certainly the T4T8 ratio is one test that everyone's been aware of. What meaning or how much importance can be placed on the results that gay men are finding of the T4T8 ratio?
Well, I'm not an immunologist, but it was very apparent early on that this was a disease of cellular immunity. So one of the first places to look is the cells that are involved with cellular immunity, and those are lymphocytes, monocytes. So the T cells were looked at, and lo and behold, they had these markedly abnormal ratios, which is not found in any other disease except for graft versus host disease and acute mono. Now, yes, they can, ratio can become temporarily inverted in a common cold or so, but it comes back to normal very quickly. This disease, the T-cell ratio is consistently inverted. So it is significant. It is a hallmark for this disease. Now, that doesn't mean it has anything to do with what makes the disease. It doesn't mean that that is the primary problem. And it doesn't mean that one T-cell ratio is enough to get anybody upset. If they are low consistently, it is certainly a matter of concern. And I have been following patients. I have one group of patients of 40 men that I've followed now for 2 years. And of the 40 men, who have low T-cell ratios, and lymphadenopathy, 2/3 of them have gotten better, just spontaneously without any kind of intervention.
What would you attribute their getting better to?
Well, they have all changed their lifestyles now, so that they have been advised by me that there seems to be a relationship between sexual activity and infection and lowering their T-cell ratios, or else something happens through sex in the population at this time. There is something out there. And they are advised to have one partner or to become celibate. I mean, it's really very radical advice. And I don't know how, you know, it would be hard to try it on a heterosexual population to give advice like that. But because responsible men are so scared now and worried about their health, and rightly so, they listen, and they've been extremely responsible in changing things. The 25 prostitutes I studied, one was really abnormal. She was very, very sick. She also had a very high cytomegalovirus antibody titer. And I was fortunate enough to get her back a year later, and her titer was even higher, so that it looks like she may have had a cytomegalovirus infection. And her ratio started out as 0.019. And
that's about as low as you can
get.
get.
Very low. She was very sick. She had lost 35 pounds in a year, was barely able to move. She really looked like an AIDS patient, but she's gotten better. And I think there are many patients who do get better. Now, I can't say that she didn't have a cytomegalovirus infection. She may have. And then again, I can't tell often where cytomegalovirus ends and AIDS begins. In the women that I've had who have had AIDS, and I've had 3 that I've studied, actually 5, but of 3 that I have studied, they also had partners, sexual partners, who were intravenous drug addicts. So I cannot say that they got their AIDS. One of them had rectal sex with her husband all the time, but he was also a drug addict. One was a prostitute, but her lover was a drug addict about 5 years before she got the disease. And then how can I say that her Johns weren't addicts? Mm-hmm. Right? Or that they weren't bisexual men, or so because of not knowing who a prostitute has sex with and not being able to find them and know them, just eliminate it as a variable, and study women who definitely have sexual partners who are drug addicts or who are drug addicts themselves. So that's what I'm doing now. I have a large project planned, which the state of New York, in its wisdom, the AIDS Institute, has seen fit to fund. So I hope that I'll have some better results.
And in closing, what do you hope will come out of your study that you've just been funded by the New York State AIDS Institute?
Well, we're going to really go into details with the women. Hopefully they'll be cooperative, and we'll get good sexual histories, and we'll know how many sexual partners they've had, what type of sexual practices, and subdivide all our results according to the sexual behavior. Okay, I'm the recipient of another grant from the Cancer Research Institute to study women who are having rectal sex. And I would really, if anybody out there can send me any women who have rectal sex, I would really appreciate it. I took an ad in Screw magazine, which my daughter has gone all over her high school telling everybody that her mother advertises in Screw. I'm getting strange looks from people. But I really have only gotten 2 replies, and those women didn't show up. So I'm looking for volunteers. Any woman, and absolute anonymity is guaranteed.
Many gay men have wondered, if there is a link between promiscuous sexual activity and AIDS, then why haven't prostitutes been affected? In fact, what Dr. Wallace is studying may illuminate the relationship between certain sexual activity and the immune function. Today, the New York State AIDS Institute awarded Dr. Wallace funding in order to study 100 women who are sexually active.
The fungus has never been known to cause disease in humans, but recently it turned up in the blood of 3 AIDS victims. The fungus produces a chemical called Cy-AIDS. It's similar to cyclosporin, a new drug used to temporarily lower the body's resistance to organ transplants. Folks says it'll take a lot more research to learn if the fungus causes the illness or just lowers body resistance, or if it was just a case of contaminated culture. Coming up in just a moment, one branch of Congress says